I became a doctor because my favorite uncle is an ophthalmologist. And I actually didn't want to become a doctor so much as I wanted to become like him. We grew up in Michigan, but my favorite uncle is an ophthalmologist in India, or was until he passed away. And he had his clinic attached to his house. And he actually had an operating room that was in his house as well. So when I was a kid, I would just follow him around everywhere because he was the greatest guy I knew. And the house was right in the middle of downtown Old Delhi. So it's the busiest part of the entire city. So we weren't allowed to go play outside. So the only thing I had to do for fun was to hang out with him. And eventually, I just wanted to keep doing what he did because he was great. And that was the main reason I went into ophthalmology. Retina is the coolest part of the whole body. There's a few reasons I went into retina. First, it's really the prettiest part of the eye to look at. It has this beautiful golden reddish orange hue to it. It has a lot of diseases that we can actually see. It ties in great to a lot of systemic diseases like diabetes or high blood pressure or conditions like lupus. So we can actually sort of get an insight into what's going on with the whole person, not just their eye. And there's a lot of really cool treatments, both medically and surgically and with lasers that we can do to make people better. It's pretty awesome. So I was lucky enough to be selected to be a Retina Fellow here back in 2002. And when I was growing up in the Midwest, there's certain places that you read about in the country that are supposed to be truly not just the best in the U.S., but the best in the world. And one of the things that you look at when you're a resident is the Will's Eye Manual. And really, even from an early, part of my career, you appreciate how great Will's is, both in terms of its ability to teach people how to be ophthalmologists, but also in creating new knowledge and having the best people in every specialty. So when I completed my fellowship, I was on faculty at a different department before I got invited to come back. And coming back here is really one of the greatest places that I could ever imagine practicing. My partners on the retina service are all fantastic. Our trainees are amazing. They keep us at the top of our game and they help us learn and get better. And my colleagues in every single specialty are truly the best in the world. So when we get complicated patients, I have a bunch of people that I can share the patient's care with. It makes me better and helps me help my patients to the best of our ability. So we spent a lot of time with our 2-year-old. He's really just a fun guy. He's starting to talk a lot. And what he's really good at now is making coffee. He's probably the best 2-year-old barista in the whole world. And if you ask him, he knows to take out the grinder. He'll ask for a scoop, put the coffee in the grinder, then he'll make sure that you take out the milk and the sugar, and he's not allowed to pour the hot water yet, but he pushes the coffee through and really just makes a mean cup. Last weekend we started working on making a cappuccino. His foam is really spectacular.